I'm Julie Hikes, the Communications and Production Manager here at the Children's Inn at NIH, and I'm going to start out by telling you a little bit about the history of NIH. So the Children's Inn was built in 1990, and it was built in response to the increased pediatric research that was going on right here on the campus of the National Institutes of Health, the increased pediatric research. And there was a doctor by the name of Phil Pizzo, who was the chief of pediatric oncology in the late 80s, and he realized that a lot of the families were congregating in the waiting rooms after their day of treatment, and they didn't want to have to go back to hotels at night, which is where they had to stay before there was a Children's Inn. And so he noticed that they were kind of being a support system and a shoulder to cry on, and they really didn't want to have to leave, and he thought, wouldn't it be nice if there was a place right here on campus that was very close where all of the families could stay together at night and be together, and it would be great if they didn't have to pay to stay there. So it was his idea, and he joined together with a group of congressional spouses at the time who were very involved in this great mission of what the inn would do. And so the congressional spouses helped to raise money, and Merck Pharmaceuticals donated $3.7 million for the inn to be built, and NIH donated the 2.5 acres of land that we sit on. And so we have a very unique private-public partnership with NIH, because while they are government-run and federally funded, we actually are a private nonprofit, so we have to raise all of our funds. But we're very happy to say that we don't have to charge our families anything to stay here, so it's really a huge financial burden that is lifted from our families by being able to stay here. And quite honestly, I think probably a lot of our families might not be able to have their children participate in the research if they had to pay to stay in a hotel. We have had families staying here from, we're up to 82 different countries now, and from all 50 states, so we never know what kind of smells are going to be coming out of our kitchen. It could be curry in the morning, you never know. And that has created a lot of challenges for us, kind of getting to know all the cultural differences, but it's been a really wonderful experience, I think, for all of us. So the families come here. A lot of times it's a last resort. Conventional treatments in their home states or countries have failed, and so their home doctor will connect them with a doctor here at NIH that is doing a research study on their child's condition. It can be a life-threatening condition, or it can just be a chronic, lifelong disease that the child may have and struggle with throughout their life. So we have, I think we have, are we at 19 or 20 full-time staff members now?
Pretty close.
And about 9 part-time staff members, and that's a relatively small staff because we do have 59 sleeping rooms, so we can accommodate up to 59 families each evening. But one of the reasons why we can provide all of the services that we provide with such a small staff is because of our wonderful volunteer program. And so I'm going to let Laura talk to you a little bit about how many volunteers we have and what all of the wonderful things that they do.
I'm Laura King, and I'm the Director of Volunteers and Community Outreach. And here at the Inn, we have approximately 250 volunteers. These are volunteers that are on set schedules, typically 2 to 4 hours per shift, and they're screened, their backgrounds are checked, and they're fully trained before they start. So these are very caring, compassionate people, and they typically fill roles of administrative support staff positions, operational related positions, stocking shelves, replacing food supplies in the kitchens. They could be taking families to the grocery store each night. They could be doing arts and crafts activities in our arts and crafts studio. They can be the friendly face at the welcome desk, greeting them and checking them into their rooms. So we use them in many different areas of the inn, and without their help we wouldn't be able to provide the family programs that we have here. And the types of programs that we have that we also staff with the volunteers include therapeutic, music, spiritual wellness, teen programming. So we try to touch upon many different areas that we can provide assistance to the family in addition to the housing component.
What are the typical ages of the children?
Of the children staying at the inn, well, typically they're pediatric patients, so
Okay.
to speak. So you could say newborn to 18.
Okay.
However, some of the institutes don't define the age at 18, and they may go as high as 25. So the limit here would be 25.
Okay.
And I would say that's not typical that you see many patients here in their 20s, but more along the lines of maybe 5 to 18 years old.
And typically, how do people hear about the Children's Inn?
Most people find out through some type of medical clinician that is helping them with their child's diagnosis or whatever's been going on in their life as far as the medical concern. But two, we have found that families find out through the internet and just word of mouth. And if you type in medical situations and problems and concerns, a lot of times NIH will pop up, and then in addition to NIH, the Children's Inn is mentioned.
What's the typical length of stay for a family? Is it 1 day? Is it 1 month?
The average stay is about 3.5 days.
3.5.
Some of the families can come in and leave sooner if it's just a quick checkup, or if it's to pick up medicines, refills, meet with the physicians. Anything that may be more invasive as far as the medical procedures, surgery, transplants, chemotherapy treatments, that could last weeks, months. It just depends. Most people are on active treatment, which could mean if they're here for 3 days, they may be coming back in 3 weeks for another round of appointments.
Okay, great. And in terms of volunteers, are you still looking for volunteers, and how can other people be a part and help support this organization?
Right now we have enough volunteers for the standard shifts that we typically schedule for a given day. Where we're looking for volunteers are to come in and host special activities and events for the families, such as hosting a dinner on a Sunday night. And this is a great opportunity for groups to come in, prepare a meal in our kitchens, and serve the meal to the families. You get a chance to meet them, find out their experiences, and have that human element to the dinner and then the environment and helping out.
Okay, great. I appreciate you sharing that information.